Lower back pain is a common complaint affecting all ages. It ranges from mild to intense pain, but relief doesn't always require medication. Natural methods like better posture, exercises, and lifestyle changes can help manage and prevent pain, improving mobility and comfort. In this video, we'll explore strategies to relieve lower back pain naturally. From stretching and strengthening exercises to heat and cold therapy, you'll discover practical tips to support your spine, improve posture, and live a more pain-free life without relying solely on medications. Improving posture is crucial for preventing and relieving lower back pain. Poor posture stresses the spine and muscles, leading to discomfort. Sit with feet flat, back straight, and shoulders relaxed. Use lumbar support and avoid slouching. Stand with weight evenly distributed and knees slightly bent. Proper sleeping posture is essential. Sleep on your side with a pillow between your knees or on your back with a pillow under your knees to align the spine and reduce pressure. These adjustments help maintain spinal health and prevent lower back pain during sleep. Gentle stretching relieves lower back pain by easing tension, increasing flexibility, and improving circulation. Tight muscles in the back, hips, and hamstrings contribute to discomfort. Stretches like child's pose, cat-cow, and hamstring stretch reduce strain and support back health. Strengthening muscles supporting the spine, like the core, glutes, and lower back, prevents and manages pain. Weak muscles cause instability and poor posture. Exercises like planks, bridges, and bird dog improve spinal support, reduce pain, and protect against future injury. Heat and cold therapy relieve lower back pain based on cause and severity. Heat relaxes muscles and increases blood flow, ideal for stiffness. Cold reduces swelling and numbs pain, ideal for acute pain. Contrast therapy alternates heat and cold for ongoing pain management. Staying active. Although it might feel natural to rest when you're experiencing back pain, staying active is one of the most important things you can do for recovery and prevention. Prolonged bed rest can weaken your core muscles and actually prolong the pain. Instead, focus on low-impact activities that keep your body moving and your muscles strong. Walking is a great starting point. It promotes circulation and helps keep your spine mobile without causing strain. Swimming is another excellent option because the water supports your body while allowing for a full body workout that's gentle on the joints and spine. Practices like yoga and Pilates combine stretching and strengthening with mindfulness, which can reduce stress and muscle tension in your lower back. Even cycling on a stationary bike can be effective if done with proper form. Incorporating regular movement into your daily routine builds strength, increases flexibility, and plays a key role in long-term back health. Beyond posture, exercise, and therapy, small lifestyle changes can also make a big difference in how your lower back feels day to day. One important habit is to be mindful of how you lift objects. Always bend at your knees, not your waist, and use your legs to lift, keeping the item close to your body. Twisting or jerking movements while lifting can easily strain your lower back. It's also helpful to avoid sitting for too long at a time. If you work at a desk, try standing up and stretching every 30 to 60 minutes to keep your muscles from tightening. Ergonomic adjustments to your workstation, like using a standing desk, a supportive chair, or adjusting monitor height, can significantly reduce spinal strain. Managing stress is another often overlooked aspect. High stress levels can cause muscles to tense up, especially in the shoulders and back. Practices such as deep breathing, meditation, or mindfulness can reduce this tension and help your body stay relaxed and balanced. When to seek professional help. While natural methods can be very effective for most cases of lower back pain, it's important to know when it's time to seek professional medical advice. If your pain persists for more than a few weeks, is severe, or is accompanied by symptoms like numbness, tingling, weakness in your legs, or loss of bladder or bowel control, you should see a doctor right away. These could be signs of a more serious condition such as a herniated disc or spinal nerve compression. Physical therapists, chiropractors, and other back care specialists can provide personalized treatment plans that include targeted exercises, hands-on therapies, and diagnostic tests if needed. Early intervention can prevent your condition from worsening and help you return to normal activity faster. Don't ignore persistent pain. Listening to your body and getting the right support when needed is key to long-term spine health and overall well-being. Nutrition and hydration for back health. What you eat also plays a significant role in the health of your spine and muscles. A balanced diet rich in anti-inflammatory foods can help reduce chronic pain and support tissue repair. Focus on whole foods like leafy greens, berries, fatty fish, nuts, seeds, and olive oil. These are packed with nutrients that help combat inflammation in the body, which is often a contributing factor to lower back discomfort. Foods rich in magnesium, calcium, and vitamin D, such as spinach, almonds, yogurt, and fortified cereals, support bone health and muscle function. Proper hydration is equally important. Intervertebral discs, which act as cushions between your spinal vertebrae, are made mostly of water. Staying well hydrated helps keep these discs flexible and functioning properly, which can reduce the risk of disc degeneration or herniation. Limiting sugary, processed foods, and alcohol can also help you maintain a healthy weight and reduce the load on your lower back. Weight management and core stability. Excess body weight, especially around the midsection, puts extra strain on your lower back. Over time, this can lead to postural changes and muscle imbalances that make pain worse. Maintaining a healthy weight through proper diet and consistent exercise can significantly reduce the burden on your spine and improve your mobility. It's not about being thin, it's about core stability. A strong core helps balance your body and support your spine with every movement, from walking to lifting. Incorporating core-focused workouts like Pilates, yoga, or specific abdominal exercises such as dead bugs, side planks, and leg raises can improve your overall stability and reduce the risk of injury. Building endurance in your core muscles allows you to perform everyday tasks more safely and comfortably. If you're just starting out, work with a fitness trainer or physical therapist to create a safe and effective program tailored to your needs and pain level. Proper footwear and support. Believe it or not, your feet can also impact your lower back. Wearing unsupportive shoes, especially ones with no arch support, such as flip-flops or worn-out sneakers, can alter your posture and alignment. This misalignment travels up the legs and hips, eventually affecting your lower back. Choosing shoes with proper arch support, cushioning, and a stable heel can make a huge difference. If you stand or walk a lot during the day, consider investing in quality footwear designed for your specific foot shape and activity level. In some cases, orthotic inserts may be recommended by a podiatrist to help correct posture and relieve back strain. At home, avoid walking barefoot on hard surfaces for extended periods. Something as simple as wearing house shoes or supportive slippers indoors can ease the impact on your lower spine. Good foot support contributes to good posture, which in turn protects your back. Daily habits and back-friendly routines. Incorporating back-friendly habits into your daily routine can make a big difference over time. For example, when using a smartphone, bring it up to eye level instead of bending your neck forward, a position often called tech neck, which can add strain to your spine. When working on a laptop, use a stand or external monitor to avoid hunching over. Break up long periods of inactivity with short walks or gentle stretches. Even household tasks like vacuuming, gardening, or doing laundry can be hard on your back if done with poor form. Try to bend at your knees, not your waist, and keep objects close to your body to avoid reaching or twisting. When driving, adjust your seat so your knees are level with your hips, and use a small pillow or lumbar roll for back support. These minor changes, when practiced consistently, can go a long way in keeping your lower back healthy and pain-free. Stress management and mind-body connection. Emotional stress doesn't just affect your mind. It can also manifest physically, particularly in the muscles around your neck, shoulders, and lower back. When you're anxious or overwhelmed, your muscles tend to tense up unconsciously, leading to tightness, stiffness, and pain. Practicing stress-reducing techniques can help release this tension and promote healing. Deep breathing exercises, progressive muscle relaxation, meditation, and mindfulness practices are excellent tools to calm both the mind and body. Even just a few minutes of focused breathing per day can signal your nervous system to relax, helping reduce muscle guarding around your spine. Yoga and Tai Chi not only improve flexibility and strength, but also incorporate breath work and mental focus, making them highly effective for stress-induced back pain. Creating a daily routine that includes even short periods of relaxation can greatly improve your back's comfort and resilience over time. Workstation ergonomics for pain prevention. Many people spend long hours at a desk or computer, which can contribute to poor posture and chronic lower back pain if not set up properly. To create a back-friendly workstation, start with your chair. It should support your lower back and allow your feet to rest flat on the floor. If needed, use a footrest. Your monitor should be at eye level to avoid leaning forward, and your keyboard and mouse should be positioned so your arms remain at a comfortable 90-degree angle. If you use a laptop, consider adding a separate keyboard and mouse with a riser or external monitor to maintain good neck and spine alignment. Take micro breaks every 30 minutes. Stand up, stretch, or walk around briefly to keep blood flowing and reduce stiffness. If possible, use a sit-stand desk to vary your position throughout the day. These adjustments may seem small, but they can significantly reduce daily strain on your lower back. Sleep quality and mattress support. Your sleep environment plays a crucial role in your spinal health. If you frequently wake up with back pain, your mattress or sleep posture may be to blame. A mattress that is too soft can let your body sink and misalign your spine, while one that's too firm might not allow enough contouring support. Most experts recommend a medium-firm mattress that supports the natural curves of your spine. Pair that with a supportive pillow that keeps your head aligned with your spine, whether you're sleeping on your back or side. Sleeping on your back with a pillow under your knees, or on your side with a pillow between your legs, helps reduce pressure on your lower back and keep your spine properly aligned. Also, try to maintain a consistent sleep schedule, as restorative sleep supports muscle recovery and pain regulation. A good night's sleep doesn't just rest your mind, it helps your back heal, too. Long-term maintenance and prevention. Once you've found relief from lower back pain, the key is to maintain the habits that helped you heal and prevent future flare-ups.